Yes, my name is David Kaiser. I'm from Youngstown. I've lived in Rhode Island for 19 years, and I feel very lucky to have two senators who are trying to address this very difficult problem in a calm and rational manner. Now, I have a very specific point to make about cost cutting, but first I do want to make another comment about Medicare, which has come up. I'm not quite old enough to be on Medicare yet, it's a few years off, but I am old enough to remember when it was passed. It was passed by a coalition of Democrats and liberal Republicans over a chorus of conservative opposition that said that Medicare was un-American, that said that Medicare was socialism, and none other than Ronald Reagan had a stock speech in which he explained that Medicare would be the beginning of the end of freedom in America. Now, all of you can ask yourselves if we would have been better off if we had listened to Barry Goldwater and Ronald Reagan and never passed Medicare. But I'd like all of you, especially the undecided people in this room, all three of you, to think a little bit about that history. Now, my question has to do with cost cutting. I'm amazed that this has not been discussed as part of this debate. It has to do with advertising for prescription drugs, which is one of these uniquely American ideas. Now, my premiums and your premiums, my private health insurance premiums, my Medicare premiums are paying for other people's drugs. I don't object to that. I want theirs to pay for mine. I don't object to paying for other people's Cialis and Viagra. But what I do object to is indirectly paying for tens of millions, maybe billions of dollars of advertisements for those drugs that you see every time you turn. If they're sick, doctors are supposed to know what to give them if they're sick. And I don't know how many of you know this, but all our drug companies spend considerably more money on marketing than they do on drugs. So my question for you is, why is there no move to do something about this? Because it looks to me like a very obvious way to save some money.
I agree with you. Where's your vote box? Subsidized advertising. My concept too is, if I'm going to my physician asking for help, he knows the prescription better than I do. There has been a proposal in the House by Congressman Abbott of New York to deny the tax deduction for this type of advertising. That is something that we haven't considered yet, because there will be all these options about tax provisions are going to be considered by the Finance Committee, but I mean, I agree with your sense that this seems to be a logical proposal to try to rein in costs at the same time not impair care at all.
And while we're at it, I would love to see us allow the Secretary of Health and Human Services to negotiate over prices with the pharmaceutical industry. For all the concern about, price fixing, what we basically did was bill price fixing by the pharmaceutical industry to the laws of the United States in a way that no other industry enjoys, that has cost billions of dollars, and it's very, very important, I think, that we address that. So you've raised a very good point, I appreciate that. Annie.
Hi, my name's Annie, I'm from Providence, and I have one comment and then a question. My comment is, some people have suggested that privatizing this system would be a better way to do it, but that scares me a lot. I don't know that businessmen are concerned with the bottom line, and they're not accountable to me, but you are both accountable to me. But my question is, many of my contemporaries, including my younger sister who just graduated from college, have stepped into a job market that is very bleak, and they are cobbling together part-time jobs to make it work, and they're making it work, but those part-time jobs do not pay them health insurance. So I'm wondering how this plan is going to help them.
They would be eligible to go into the exchange to choose a plan, either private or public option. Based on their income level, they will see some subsidy support that would make it affordable for them. And just parenthetically, this is a comment that I hear as I move around, particularly from recent college graduates, that they're without health care coverage, they need it, and they're urging us to do something to provide it.
tends to be the time when we should start to let people go. I will be staying around. We take a general vote as to whether we should do 2 more questions or just let everybody go. We'll do 2 more, and then we'll let everybody go. I appreciate the patience, but I think there's a lot of interest here. We'll do the gentleman in the red shirt right here, and the white jacket with the very impressive-looking medical apparatus right in stack back here. Go ahead.
You know, I'm not in favor of the public plan because for the last 20 years I've been a pretty staunch advocate of the single payer plan. So people were just about to cheer. Stop. I have one question. I have 100 questions. I'm going to ask one, and that is that I'm from the beautiful East Bay, and I'm in Barrie, and I'm sitting here trying to figure out how this country, which I served in the military and a social worker for 33 years, how we got to a place where we care so little about 50 million of our neighbors, working people, because people who are not working, people who are not working have an opportunity to avail themselves of a plan. I've been working with poor people for 33 years. Very few of them did not have health care. The people we're talking about are your neighbors who are working people, and you know what? You can be you tomorrow. So to care so little about 50 million of your neighbors is very painful for me, and any plan that brings us up into the 21st century where we care about our neighbors in a way that we profess to is very important to me. Thank you.
First of all, I agree with you, and to the extent that I have said during the course of the evening that I think cost control is the primary goal we have to achieve, it is because I believe that if we cover everybody and don't do the cost control, then in 4 or 5 years it will have fallen apart for those people, and it won't have been a promise we can keep. And so I'm not walking away at all from the importance of trying to cover every American when I say that. I just want to make sure that's clear. The other thing I think is worth remembering is that when we talk about nearly 50 million Americans who are uninsured, we're actually really undercounting. Because what that is 50 million Americans who are uninsured at any given minute. For instance, tonight, right now. But if you go through the whole year, because people lose their coverage, and then they get a job, and then they get it back, there are as many as 90 million Americans who in any given year experience being uninsured. So as a worry for American families, it's incredibly prevalent. It's not just the uninsured, it's also those who are on the edge of being uninsured or who just got uninsured after a period of being uninsured. And then of course everybody who knows that they are one paycheck, one end of their job, one